welcome to the Startup Central, the only show of its kind on Indian television dedicated to startups, innovation, technology, disruption. Basically, if it falls under the gambit of the new economy, it's here every weekday on ET Now at 6 p.m. I'm Nayantara, working from home, and I will be with you over the next 30 minutes. Ladies and gentlemen, pretty much like all the startups that we feature on the show, Team Startup Central thrives on constructive feedback. Don't hold back, keep writing into us, tell us how you want us to do the show differently, how we can improve what it is that we're doing that you don't like, all of that. We want to hear about it. Keep writing into us. Our email address right on top, suc@etnow.tv. I'm also on Twitter. You can reach out to me directly. Now, when you're talking about disruption, you couldn't have had a bigger disruption than coronavirus. Sequoia Capital at the start of 2020 said it's a black swan event. Whether it's a black swan or a white swan is of course debatable, but the fact is that life has not been the same since the outbreak of coronavirus, and it has certainly put a strain on the healthcare infrastructure. Healthcare, when we talk about it, India doesn't have a single unicorn from the healthcare space. So clearly a lot that needs to be done for healthcare in the old economy as well as the new economy. With that, I'm going to now invite my guest for the day. This is Medicor, the founder, Shreyans Mehta, who's now joining us on Startup Central. Why am I getting Shreyans on the show? I first met him about a year ago when he actually won a challenge that was put out by the Union Commerce Ministry under the aegis of the DIPP and Startup India and WhatsApp. It was a challenge that one of the winners was Medicor and Shreyans Mehta. What he is doing is building technology and digitizing healthcare in Bharat for Bharat. It's a company that started in Kota. It has an app and has done some groundbreaking work during COVID-19. Shreyans, I'm so happy to be talking to you again. I believe you've really risen to the challenge during coronavirus, that your app IU has been used in Rajasthan, particularly in the rural parts, to make sure that those in villages are safe and they get access to healthcare. What have you been up to during COVID-19?
First of all, thank you so much for the introduction, Nayantara. So, as soon as this COVID crisis occurred, there was a huge setback in the villages also because of lack of logistics, and they were stuck there. We at India are as such not a healthy country where around 50 to 60% people normally visit OPDs in cities. So when the transportation was halted, the people in rural and semi-urban parts of India were facing huge troubles. So at that point of time, we make sure that we also wanted to focus on the non-COVID issues as well. So in those areas, especially in Rajasthan, we from our network of medical stores, which is the Sehat Sathis, and the people who have smartphones through our IU app, we provided them consultations in less than 30 minutes with the support of Rajasthan government as well, wherein this was publicized to all the people of the state of Rajasthan that you stay at home, stay safe, and for any need of consultation and medication, you can directly get it from our both suite of apps.
Yeah.
And more than 700,000 people in Rajasthan in last 2 months made use of this facility.
So Shreyans, let me just back up a bit. You're trying to solve non-COVID issues using IU, your app. You've added nearly 7 lakh people, you're saying, in the last 2 months since the breakout of the pandemic in India, like getting it serious, being serious, a lockdown, etc. How does it work? Because you've always said that IU is for Bharat, being built in Bharat. How did it work during a lockdown? Because from what I remember, your model is also based on the fact that you will provide remote healthcare facilities, which is a doctor, and the medicines will already be at the pharmacy closest to the village. What were the challenges that you faced during the lockdown, and did this model work during lockdown, or did you have to change it?
Yeah, so we had to just do a small pivot in our entire ecosystem. Medical stores were already our partners But what we did was that during lockdown, one major issues was logistics. And even if if user or a patient can get consultation, the second part of the problem is that how will he get medicines. Now, since logistics was hugely suffered, we also made all the medical stores effectively online with our Sehat Sathi app. So user from IU app can directly share his prescription to the nearby medical stores, whichever is there in his area, and that medical store can deliver the medicines in less than an hour to the patient directly. So that ecosystem of ours, the hyper local connected ecosystem of doctors, patients, and medical stores helped in this COVID phase a lot. And one more interesting aspect which happened was that prior to lockdown we were a company who were majorly focused and majorly our users were only from Rajasthan. But now after lockdown we now have presence in more than 13 states and more than 10,000 medical stores have become online from more than 800 plus locations. So that has widened the horizon of helping.
But tell me something, Shreyas, also for you to do this and to pivot. So Shreyas, for you to have pivoted and to have increased your infrastructure, internet infrastructure and all of that, I'm guessing you would have needed money. Last time I met you was of course at the WhatsApp challenge that you won, the WhatsApp and the Government of India's challenge, you were one of the winners. But I still remember how Sanjeev Bikhchandani of InfoEdge, for example, has been one of your early investors. Did you go back to your existing investors and say that, I'm in healthcare, look what's happening, my business can really pick up, I'm solving problems, I need more money?
Yeah, so Nayantara, just prior to the lockdown, we closed our round as well. So that and we were backed by both our existing investors, which is the InfoEdge and WaterBridge, and two external investors also participated in the round. So just before lockdown, maybe say 24th March was lockdown, and around on 20th of March we had the money in the bank. So we were quite lucky on that part.
Okay.
And
lucky, I think, boss, kya timing nikli, huh? But but having said that, I want to focus a little more about the big problem that you're solving. If COVID-19 has exposed something, it's the very fact that we don't, our healthcare infrastructure has been exposed. Tell me something, Shreyas, you've also seen, I'm sure, the proliferation of a lot of startups now around healthcare. There was a lot of confusion around telemedicine, which the government then clarified during the lockdown. On the other flip side, you also don't have enough doctors, as it's seeming to come out right now. How are you dealing with all of that? Because you are trying to provide medical facilities in villages, in areas, and in parts of Bharat where there is no hospital or no proper doctors. How are you finding the basic commodity, which is doctors?
Yeah, so Nayantara, one basic, what we have experienced is that, the skewedness in India, which we all say that, there is huge gap of doctors with respect to number of patients. So one of the important thing is that, doctors are majorly living in cities. And not all doctors have, lot of patients coming to them, because it is a tradition that, the popular doctors only get most of the patients. But what has happened with us is, since our platform for doctors is so hyper locally connected and so easy to use, since we have huge experience of healthcare in our team, so our doctors network has also risen from say 1,000 doctors before March to more than 5,000 plus doctors in next 2 months or so till now. So that has that problem has not faced us, and this is also providing safety to the doctors, that now doctors are able to connect digitally with their patients in a better way. And the beauty of our platform was that their entire health history was already on our platform. So doctors now have very easily able to diagnose, and they can also follow ups from our platform without actually being exposed to the risk of COVID-19. So in that way, it is also helping the doctors seeing their
but tell me something. I take these points. I take the point. I take your point. But you had to take time from them, na. The point is, there's a pandemic on. They're all in existing brick and mortar hospitals, clinics. you also have a situation where healthcare workers are being quarantined the minute they're exposed to a COVID-19 patient.
Yeah, but they can consult very easily from phone. So even if they are doing say home quarantine or self quarantine, it is not stopping them to use a phone. So they are very easily able to consult patients from phone. Yeah, and lot of private hospitals
I got it.
work. Yeah.
So Shreyans, also tell me something, and it's going to be my final question to you. You know, you've added in Rajasthan alone 7 lakh families. Are you still following the model of, because not everybody, while we're seeing data being the new oil and proliferation of smartphones and all of that, is your model still that you tie up with the sarpanch, who then makes sure that the villagers have access, or that the medical store is the one you tie up with and it's on that medical store owner's phone, the doctors consult with the villagers? Is that still your model, or have you had to pivot from that as well?
No, so we have done, we have done lot of, हमने काफी सारे थोड़े छोटे मोटे छोटे changes किए हैं, so that we are able to cover more and more patients and users. So what has happened is, even the Honorable Prime Minister has been saying for Atmanirbhar Bharat and vocal for local. So what we have done is that we had opened up our ecosystem of healthcare, wherein now patients can directly invite their preferred medical store and their own doctor to our platform. Similarly, medical stores can invite patients saying that my medical store has become online, and apne to apne hote hain campaign, wherein my medical store is now online and I will be able to serve you the fastest. So he can invite the local users who are there in their phone. And similarly, doctors can also communicate to the patients that hey, I can now directly consult you from my phone, and you can just download IU app or go to a nearby pharmacy to take consultation from me. So what we have done is that
okay,
yeah, from the earlier model,
Shreyans, like you said, you're a portfolio company of Shreyans, like you were saying, you're a portfolio company of Info Edge. You have access to someone who's so respected in the world of startups, entrepreneurship, stock market, now winner of the Padma Awards as well. Tell me something during all of this. Can you share with us what advice did Sanjeev Bikhchandani give you? You have access to him. You're very lucky in that regard. You got him to sign a check also. What has been his advice to you?
So sir's advice was very clear from the day of inception. He has always said that focus on the core problem. Never ever divert your focus from the core problem which you have. That you want to solve this problem for Bharat, and whatever things comes in this journey, which is solving your core problem, just adapt to that quickly. And that advice of him has helped us to evolve and adopt in this COVID phase, while expanding our framework of building Bharat ka apna bharosemand healthcare, because health is all about trust, and now people are inviting their own medical store and their own favored doctors. So that has that advice of him has helped us a lot. And also just 3 months before COVID, he has also told us one more very critical thing, that cost time is going to change, so you should focus on the unit economics very, very hard. And that has helped us a lot, because from the month of February itself, we were focusing more on the unit economics and less on burning of money as well.
But tell me, is it a misnomer then that if you're in rural services, it is more difficult to monetize, more difficult to make money, because you can't charge the same rates that is charged in urban areas. Most of your doctors are in urban cities. They're used to those kind of fees and all of that. How do you work on that when you're focusing on unit economics? How much do you charge, for example, for a consultation?
Yes, so we charge currently a flat of 99 rupees for a consultation, and we are making 35% average profit on every consultation.
So you pay your 99 rupees what you charge, you make 35% profit. That takes care of any overheads, and the biggest one I would imagine is the doctor fee, right? That you pay.
Yeah, so doctor fees is included in that. So our doctors payout fees is currently, around 60 to 65 rupees.
So these
is our
doctors are
average.
giving you a massive discount, or you basically have empaneled them and you pay them monthly or something. Is it like that?
No, no, not empanelment and monthly, but most of the doctors who have associated with us is, they have also, joined us in our vision of, helping the users of Bharat, and, to help them with the maximum
Okay.
possible ways. So most of the doctors, the 5,000 plus doctors which are there on our platform currently, have their agenda very fixed that they want to help people. So money, with respect to that, is not a big problem for them. They also are, more aligned towards our vision that we want to help more and more people.
It's very nice to hear and heartening to hear the doctors are willing to take time out, and do this kind of, if I may call it, seva, giving back to society in a sense, and that's technology which is making sure that people in the villages also get access to healthcare. Shreyans, thanks so much for joining us and being so candid here on ET Now.